Hello, this is Dr. Rajni Mandal from Pathology Watch here with your 3D 3-minute digital dermatopathology digest. Today's topic is sebaceous neoplasms. Sebaceous glands are seen here in the dermis. They are formed by mature sebocytes and immature sebaceous cells. Mature sebocytes show a vacuolated cytoplasm, which can sometimes indent the nucleus. This is in contrast to the immature cells that show increased in nuclear cytoplasmic ratio and sometimes have foamy cytoplasm. Here is a nevus sebaceous. You can see here that there is surface papillomatosis, as well as a proliferation of sebaceous glands and sometimes apocrine glands. Nevus sebaceous has an increased risk of basal cell carcinoma, trichoblastoma, and syringocystadenoma papilliferum. Here is a sebaceous adenoma. This is a circumscribed proliferation in the dermis, which can sometimes show connection to the overlying epidermis. You can see here a proliferation of predominantly mature sebocytes compared to immature sebocytes. Here, sebaceous adenoma is defined as having greater than 50% mature sebaceous cells compared to the basaloid cells. This is in contrast to a sebaceoma. This can present as multiple nests in the dermis, and you can see here a predominance of the immature basaloid cells compared to the mature sebocytes. Sebaciomas show greater than 50% basaloid cells compared to mature sebaceous cells. The malignant counterpart of a sebaceous neoplasm is here. This is sebaceous carcinoma. Sebaceous carcinoma is most common in the eyelid, originating from the meibomian gland. Sebaceous carcinoma can involve the dermis, as a proliferation of predominantly immature cells. These cells show increased proliferative activity with apoptotic figures and increased nuclear to cytoplasmic ratio as well as nuclear atypia. Interspersed with the cells, you can see differentiation into sebaceous cells with foamy cytoplasm that commonly indents the central nucleus. In the epidermis, the sebaceous cells, which are predominantly immature, can actually infiltrate in a pagetoid manner, which can mimic squamous cell carcinoma in situ. So here are your 5 flashbacks for today: sebaceous neoplasms. Sebaceous differentiation is characterized by vacuolated cytoplasm with indentation of the nucleus and basaloid immature cells. Neoplasms are associated with Muratori syndrome. A nevus sebaceous shows papillomatosis, apocrine and sebaceous glands, and immature hair follicles. It can show an increased risk of basal cell carcinoma, trichoblastoma, and syringocystadenoma papilliferum. Sebaceous adenoma is a circumscribed proliferation connected to the epidermis with greater than 50% mature sebaceous cells compared to basaloid cells. A sebaceoma shows multiple nests in the dermis with greater than 50% basaloid cells compared to mature sebaceous cells. Sebaceous carcinoma is most common in the eyelid and the meibomian gland and shows variable sebaceous differentiation with foamy cells. That's it for me for today. This is Dr. Rajni Mandal from Pathology Watch, revolutionizing pathology for dermatologists. Check us out at pathologywatch.com.